Moody on the Move is presented by United Federal Credit Union. We get you.
Hi everybody, it's Pat Moody, and it's time once again for Moody on the Move, where today we're going to take you behind the scenes with the incredible team at the Cassopolis Family Clinic Network, where they promise not only to care for you, but about you. And that's coming to courtesy of our friends of United Federal Credit Union. We get you. For 40 years, Mary Middleton has worked the hallways and the care rooms of the Cassopolis Family Clinic, and yet even she is aware that many across the region are not aware that in addition to their flagship in Cassopolis, the network has a major presence here in the community of Niles, where we are today. Mary, take us back over those decades and to the origins of the organization back in 1964.
Well, thanks, Pat. The clinic originally started as the Cass Medical Clinic back in 1964 with Dr. Aaron Warren and Dr. Lowell Smith. And it's just, the models have changed over the year, the financial model has changed, the sites have changed, faces have changed, the names have changed, but it's served the community since 1964, so that's a pretty incredible thing these days.
That's a very solid background and backdrop. As a federally qualified health center and one of only 1,400 such entities across the nation, you're working diligently all the time to kind of bridge the gap of service between the uninsured and the underinsured. So tell us a little bit about your unique role in today's healthcare system that's so much different than regular providers.
Well, we are one of 1,400 organizations, but I'd like to point out that there's 13,500 sites across the U.S. because a community health center can have more than one site. In fact, we have three. We have the one in Cassopolis, the dental office here in Niles, and then Niles Community Health Center. The difference between a federally qualified health center and a private practice is the financial models are almost inverse, if you will. A private practice wants commercially insured patients that they maximize their reimbursement from an insurance company. The federally qualified health center model is set up to serve the underserved. It's intentionally set up that way so that Medicaid becomes our highest payer, where it's the lowest payer in a private practice. And the health center grant that we get through the Bureau of Primary Health Care helps us pay the bills for people who pay proportionally according to their income. So that's the major difference.
Excellent. You're capable of covering virtually every aspect and angle all the way from, the opening of care for a family or an individual, all the way through your pharmacy options, including a drive-through. So you've got all the bases covered. Talk a little bit about the wide array of services that you offer.
It's an integrated model. So for our primary care patients, they can receive their dental care here, obstetrics, gynecology, behavioral health. We have a substance use treatment program, and we do have pharmacies at both of our primary care locations as well. So it's really neat because you can be seen and your prescription is ready when you get ready to walk out the front door. It's very convenient.
Very, very convenient. So I love the aspect that you bring to the table of your pledge that, we're not here to just care for you. We're here to care about you, and you have that promise every day. Explain a little bit behind that philosophy.
I would have to say in response to that we're here to take care of people no matter what your income is. No one chooses to be born in poverty, and everyone deserves to be treated with dignity. So we've tried very hard over the years to have really nice facilities, to have excellent staff so that everyone receives great care. It doesn't matter if you are uninsured, if you're covered by Medicaid, or if you have Blue Cross and Blue Shield or Medicare. It just doesn't matter. Everyone receives great care.
Excellent. And you talked about your team, you know, and the folks who work here, the associates that make up the entire team of the Cassopolis Family Clinic Network. And like pretty much everybody else, you're probably always looking for top-notch people.
Always, always. We are blessed to have some great physicians and nurse practitioners and PAs, dentists. We're always looking for more social workers. There's a great need for behavioral health, and social workers are in short supply right now. But we have a wonderful team, and you know, they could work anywhere, but they choose to work here, and that's just a very high compliment, that they choose to work for us and that they choose to serve the less fortunate.
So Mary, if an individual or a family in Michigan's Great Southwest is looking for health care and they would like to become a part of your network, what should they do?
Well, we are accepting new patients, and all they need to do is either check us out on our website or give us a call or even stop in. You can also find us on Facebook.
I always find us on Facebook, right, every time, right? Thank you very much. So clearly, Cassopolis Family Clinic Network is a gem to the community of Michigan's Great Southwest. Again, not just working for you and caring for you, but caring about you, and that makes a huge difference in everybody's life, I'm sure. Thanks so much for joining us today, Mary. That's another edition of Moody on the Move, and Mary Middleton, CEO, taking us behind the scenes once again here at the Cassopolis Family Clinic Network. Our thanks to our friends at Little Red Fern, the production team that makes us look so great all the time, and our friends at United Federal Credit Union for making it all possible for us to be on the move all the time. Thanks, everybody, and at United Federal Credit Union, we get you.